Hi. Welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the access to care and continuity of care, ACC.
What is the process if patient requests for out-on pass?
When a patient requests an out-on pass, often referred to as a day pass or leave of absence, from the hospital, there is a specific process to ensure that the patient's request is handled appropriately while maintaining safety and continuity of care. Here's a general outline of the process. 1. Patient request. Initiation: the patient, or their family, expresses a desire to leave the hospital temporarily, typically for a few hours or a day. This request is usually made to the attending physician, nurse, or another member of the healthcare team. 2. Assessment of appropriateness. Medical evaluation. The attending physician or primary healthcare provider assesses whether the patient is medically stable enough to leave the hospital temporarily. This includes evaluating the patient's vital signs, current condition, and any ongoing treatments or interventions. The healthcare provider considers the potential risks associated with the patient leaving the hospital and whether the patient's condition could deteriorate while away. Psychosocial considerations. The healthcare team assesses the reasons for the patient's request and whether the time away will benefit the patient's emotional or psychological well-being. Consideration is given to the patient's support system and whether they will have adequate supervision and assistance during the time away from the hospital. 3. Approval process. Physician approval. If the attending physician determines that it is safe and appropriate for the patient to leave the hospital, they will grant approval for the out-on pass. This approval is typically documented in the patient's medical record. The physician will specify the conditions of the pass, such as the duration, any restrictions, and instructions the patient must follow while outside the hospital. Nursing and administrative approval. The nursing staff and, in some cases, hospital administration may need to approve the leave as well. This includes verifying that the patient has understood all instructions and that proper documentation is in place. In some hospitals, a specific form or written permission might be required, which the patient or their family may need to sign, acknowledging the terms of the pass and the patient's responsibilities. 4. Patient and family education. Discharge Instructions. The healthcare team provides detailed instructions to the patient and their family or caregivers regarding what to do and what to avoid during the time away from the hospital. This may include instructions on medications, dietary restrictions, activity limitations, and signs or symptoms that require immediate medical attention. The patient is informed of the specific time they must return to the hospital and the process for reporting any issues that arise while they are out. Emergency plan. The healthcare provider discusses an emergency plan with the patient, including who to contact and where to go if they experience any medical issues while away from the hospital. The patient may be given a direct contact number for the hospital unit or the attending physician. 5. Documentation. Medical record documentation. The patient's medical record is updated to reflect the approval of the out-on pass, including the specific instructions given to the patient, the duration of the pass, and any special considerations. Documentation may also include the patient's understanding of the risks involved and their agreement to comply with the conditions of the pass. Consent form. If required, a consent form may be signed by the patient or their legal representative, acknowledging that they are leaving the hospital temporarily and accepting the associated risks. 6. Patient departure. Checking out. The patient checks out with the nursing staff before leaving the hospital. The staff may provide a reminder of the return time and any necessary instructions. The patient may also be given a copy of the instructions or emergency contact information to carry with them. 7. Patient return. Checking in. Upon return, the patient checks back in with the nursing staff. The staff will assess the patient's condition and ensure that there were no issues during the time away. The patient's vital signs may be taken, and any relevant information about their condition while outside the hospital is documented in the medical record. Post-return evaluation. The attending physician or healthcare provider may perform a brief evaluation to ensure that the patient remains stable and that their condition has not deteriorated during their time away from the hospital. 8. Follow-up. Documentation of return. The patient's return and their condition upon return are documented in the medical record. Any relevant observations or incidents that occurred during the PASS are also noted. Adjustment of care plan. If the patient's condition has changed or if any new issues arose during the PASS, the care plan may be adjusted accordingly. Example scenario. Patient, Jane Doe. Request, day pass to attend a family event from 10 a.m. to 4 p.m. on August 7, 2024. Physician approval. Dr. Smith approves the pass after evaluating the patient's condition and ensuring that she is stable. Instructions: continue prescribed medications at the scheduled times, avoid strenuous activity, and return to the hospital by 4 p.m. Education provided. The patient and her family are instructed on what to do if she experiences any symptoms, e.g., dizziness, shortness of breath. They are given a direct contact number for the hospital unit. Documentation. Approval and instructions are documented in the patient's medical record. A consent form is signed by the patient acknowledging the risks and conditions of the pass. Return. The patient returns at 4 p.m. and her vital signs are stable. No issues were reported during her time away. This is documented in the medical record. Conclusion. By following this process, hospitals can safely manage patient requests for out on pass, ensuring that patients are well informed and that their care continues seamlessly before, during, and after their time away from the hospital.